Hi everyone. Today I'm going to be presenting a research review on the role of exercise in breast cancer patients undergoing um, adjuvant treatment, which is an umbrella review of systematic reviews and meta-analyses. The focus of the review is to use existing, obviously systematic and meta-analyses to look at the effects that exercise has on symptoms like fatigue, depression, anxiety, and overall quality of life. Um, the author is Zhao, and he and his colleagues are from multiple institutions across oncology and rehabilitation research in China. So the journal is a reputable Q2 oncology journal with a moderate impact factor, which just shows me and everyone else that the findings are credible and well recognized in the scientific community. So, a little bit of background. Breast cancer is the most common cancer among women worldwide, with treatments such as chemotherapy, radiation, and hormone therapy. And they often result in challenging side effects for these women. Some of the side effects include fatigue, depression, anxiety, reduced quality of life, and cardiorespiratory decline. Exercise has been provided as a supportive therapy to counteract these side effects, but there are individual studies and reviews that have sometimes produced like inconsistent results. This is often due to the fact that a lot of these articles and reviews are done with the women reporting their exercise status, how they exercised, how long they exercised. And so it's not just a controlled study in a lab where the clinicians are able to see exactly what the patient is doing. So it sometimes does produce inconsistent results. So, the purpose of this review was to bring together the highest level of evidence to provide a clear picture on how exercise is impacting breast cancer patients during their therapy. The review searched four major databases: PubMed, Embase, Web of Science, and the Cochrane Library. It only included systematic reviews and meta analyses that looked at exercise interventions for breast cancer patients who were currently undergoing treatment. So, outcomes did have to include fatigue, quality of life, depression, anxiety, pain, or fitness from their therapies. The authors used the Amstar 2 tool to evaluate the methods of the included reviews. And I did include a Prisma flow diagram right here, which just outlines how the authors narrowed down the search from, I think, an initial search of somewhere in the 800s to the initial search results to the final 15 systematic reviews and meta-analyses that were included. When we're looking at the results, exercise interventions were shown to significantly reduce cancer-related fatigue, quality of life, depression and anxiety, and cardiorespiratory fitness. So there were significant improvements across the quality of life reviews. Consistent reductions in depression and anxiety were reported. Improved aerobic and resistance exercises were reported, and strong evidence of reduced fatigue. The only side effect that, interestingly enough, came out as inconsistent was for pain. So they are suggesting more research needed in that area. But to get into the types of exercise and how they were recorded, both aerobic and resistance exercises were performed, and combined programs of aerobic and resistance programs seem to provide the best results. So, just because, like I was saying, the women are self reporting their exercise duration, frequency, and types, it is hard to pinpoint a specific instrument that was used during these research studies, but the closest that we could get is knowing that aerobic resistance Um, they did yoga exercises. There was combined exercises as well as mind and body exercises. So as wide and variety of equipment and tools that there are out there to help um, kind of assess physical activity. This was a wider range of tools that were used, and a lot of the women did these at home. So it was harder to know what tools were being used, but we do know the types of exercise that were being performed, as well as we can kind of piece together what was being used by the women during the times of exercise. Same here. This is just a continuation of that chart. Home based walking, yoga practice, posture practice, um, stuff like that was included in these studies. So, some of the conclusions that we can take away is that exercise is not only safe, but also highly effective for breast cancer patients. From a clinical perspective, exercise should be integrated into supportive care. We're seeing it more integrated in clinical settings in a gym. So, if clinicians or if practices do have a physical therapy room with equipment, or a rehabilitation room with equipment, women are seen to be going to these places. So, tools to help assess physical activity are in those gyms, those rehab centers, but this does mean that oncologists and rehabilitation teams should be working together to prescribe exercise programs that are structured as well as tailored to their patients' individual needs. There's also applications including a recommended mix of aerobic and resistance training, like we saw that the women were participating in, ideally supervised by professionals to help maximize physical and mental health outcomes. There are several strengths to this study. It is an umbrella review, meaning that it takes the highest level of evidence that's available from all these studies. It also assessed the quality of the included reviews using the AMSTAR 2, and it focused on the outcomes of the exercise, as well as the exercises performed that really matter to the patient. So fatigue and mental health were the two biggest side effects that mattered to the patients the most. And so the exercises and the machines that were used to tailor to fatigue and mental health. There are, however, limitations. Um, the review included like variation in terms of exercise type, intensity, and duration, just because they were self reported by the women, which makes it hard to standardize recommendations. Um, as well as some reviews had weaker methodologies and evidence for certain outcomes, such as pain, which was limited or marked as inconsistent. So, future research should focus on developing standardized exercise protocols, as well as having standardized exercise equipment available to these women during their treatment and after their treatment. We do need more long term studies to see if benefits last after the treatment ends while performing the same types of exercises that were performed during treatment. And the authors did agree that exercise should be recommended as treatment to therapy, as well as my personal take on this. I do strongly agree that exercise should become a standard part of oncology care. It provides consistent evidence that exercise improves not only physical barriers that these women are going through, but also psychological barriers. So, if we can improve these side effects for women, it would significantly improve their lives.